Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, December the 14th. We're honored to be here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nation. So we're honored to be here on their lands today. Tomorrow, Tuesday, we'll be providing a written briefing with updated COVID-19 information at approximately 3 o'clock. It's my honor now to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. We are reporting for 3 periods today. From Friday to Saturday, we had 698 new cases of COVID-19 reported in British Columbia. From Saturday to Sunday, an additional 689 cases were diagnosed, and from Sunday to today, 759, bringing our total to 2,146 new cases since our last report on Friday, including 16 epidemiologically linked cases. That brings our total number of people diagnosed with COVID-19 in British Columbia to 42,943. Of the new cases, in the last 3 days, 300 were people in Vancouver Coastal Health region, 1,474 people were in the Fraser Health region, 29 people were in Vancouver Island Health region, 250 people in the Interior Health region, and 91 people in the Northern Health region. In addition, there were 2 new cases diagnosed in people who live outside of Canada. We now have 10,039 active cases across the province, of whom 359 people are in hospital, 87 of whom are in critical care or ICU. We have 11,177 people who are under active public health monitoring, again, in every health authority in the province, and 31,207 people who are now recovered from COVID-19. Sadly, again, this weekend, we've had far too many people die from COVID-19. We've had 49 new deaths, bringing the total number of people who've died from COVID-19 to 647 in British Columbia. The number of people who have died and the number of families and care providers who've lost loved ones as part of their community over this weekend is a tragedy that all of us feel. My condolences go out to the families, the care providers, and the communities. We know that this is a most challenging and difficult time, and we mourn with you and feel your loss. We have 3 new healthcare outbreaks in the Jubilee Lodge, the Fraserview Intermediate Care Lodge, and Villa Caratal, and 6 outbreaks have been declared over in the past weekend. One of them at the Felburn Care Centre in the pathology unit. Unfortunately, there still remains an outbreak ongoing in the long-term care area. In Fleetwood Villa, the Residence Mission, the Swayas, Rainbow Gardens, the Windermere Care Centre, the second outbreak there, and the West Coast General Hospital are all over, leaving us with 55 active outbreaks in long-term care and assisted living and 7 in acute care, involving 1,305 residents and 726 staff. Today, as people will have heard, the first doses of a COVID vaccine manufactured by Pfizer and BioNTech arrived here in British Columbia, sort of late last night. And teams now are doing their final preparations to start our first immunizations in our clinics tomorrow. What this means is that we now have a safe and effective vaccine that has been approved for use here in Canada and is available here in British Columbia. And this is momentous news and the first step in our path to protecting people most at risk in our communities and taking the pressure off our healthcare system so that care is available for all of us who need it across the province. This week, the first vaccines will be given at 2 sites here in the Lower Mainland, one in Vancouver and one in the Fraser Health region. And next week, with the supply that we expect to receive, vaccine will be available in every health authority across the province. I can't tell you how exciting this is to know that this start of this new phase of being able to protect people is beginning here in BC and in Canada. As we know, the global pandemic has meant a year like no other for all of us. And we are all doing things that we have never done before. And we know as we're heading into or in the midst of this holiday celebrations that we have to remember every time we are together, there is risk. There is risk in our communities across the province right now and across the country and around the globe. No event or gathering is completely safe right now, and we need to be aware of that because the virus continues to circulate in our communities, and tragically, people continue to lose their loved ones to this virus. You may be doing all you can to protect your family, your loved ones, and yourself. And I know most people here are doing that, and it is making a difference. And that's what we all need to think about right now. It doesn't take away, however, from the potential that someone you spend time with may inadvertently bring the virus with them to your house, to your dinner table. Our homes don't have those many layers of protection that we find in other places. We spend more time close together. We aren't using masks for the most part. We don't have those barriers and those safe distances that we have in place in workplaces and other public settings. A few minutes at the grocery store or shopping in your local retail store is quite different than sitting with your extended family or with friends or loved ones that you have not seen for a while in your living room for the afternoon or for the evening or longer. If you're wondering about how to safely have those important family and friends and close connections, whatever your family is, there are many ways that you can do that in the coming weeks and make those occasions new and special. I've heard of many creative ideas, and people have been sending me some of the things that they are planning on doing or have been doing over these last few weeks. I wanted to share a few today. Some of these are like a contactless doorway drop-off of cookies or stocking stuffers or a ready-made breakfast on Christmas Eve or Christmas Day or on a special morning for you. I know some that are having Zoom holiday dinners on big screen TVs and celebrating that way. Others have gone one step further and are having the same meal with the same table decorations in each of their homes, and finding ways to cook together or to share that important communal food in a way that is safe for all of the members of their family. Some are still cooking for a large group, but doing meal delivery for their family members or friends or neighbors instead of having people over. Others are sharing holiday playlists in advance and planning for a post-meal Zoom karaoke competition, which I know nobody will invite me to who knows me. What I know about, without a doubt, is these important connections can still happen at a distance and safely. And we may create new traditions, new ways of doing things along the way. And it will ensure that those we are closest to and those we love and those who are at risk will be there to celebrate with us next year. As more people are protected with our COVID vaccine and the number of cases we hope will decline, we will be able to safely resume those activities that are paused right now for these coming weeks. As I said last week, there will be a time when we will be able to take our masks off, when we can see and hug our loved ones, our friends, when we can travel to see those others that we care about. But we are not yet there. There are no safe gatherings right now, and we have to be cautious. We have to be cautious because we are so close, but we cannot let up now. So many have done so much, and I think of all of our workers in long-term care who are tired, who've been working long hours, our frontline social sector workers, caring for those with disabilities, people who are living in our shelters, in our homeless populations, healthcare workers who are working in our COVID wards, our ICU wards, which are right now filling up, and providing care from the community to hospitals. These are what we need to think about now. We need to continue to do our part to bring our community rates down, to take that pressure off, and especially for those we know who are most at risk, to protect our elders and our seniors. This is especially important when we're at this point now where we have vaccine, and soon we'll have more widespread vaccine availability. This holiday season, let's make these special occasions special in other ways by connecting with each other and supporting each other and caring for each other virtually instead. Let's save our celebrations in person with those we care about until it's safe for us all to be together again. And let's also remember to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry, and I too wanted to pass on my condolences at the loss of 49 people over the 3 days of the weekend from COVID-19, which is, as always, an extraordinary thing. 28 of them in Fraser Health, 18 in Vancouver Coastal Health, 3 in the Northern Health Authority, and it's, as all of us know, I think, with the cancellation of many ways that we can come together as people and the limitation in celebrations of life to 10 people, this is a very, very challenging time for communities, of caregivers, of course, but also for family and friends. And this loss is a massive loss in my view, and I think in everyone's view, and our hearts go out to everyone involved. This has been an extraordinary and is an extraordinary time for public health. We have 10,039 active cases of COVID-19, 11,177 people under public health surveillance, 359 people in hospital, 87 in critical care. And as you'll see, and as you've seen from the numbers, that reflects significant transmission of COVID-19 in places such as the Northern Health Authority and the Interior Health Authority over the last few weeks that we hadn't seen for some time, and that's a significant thing that healthcare workers and communities and families are dealing with all over BC. I wanted to note a couple of things. This morning, the Premier and Dr. Henry and I met along with Dr. Robert Daum, who's assisting us in reaching out to spiritual leaders around the province, met with more than 200 people on a call of faith leaders from across BC. There was a healthy exchange and discussion that we've had. I think this is our 7th such call since the beginning of the pandemic. These calls started in March. We very much appreciated everyone who took part in that call, the suggestions that they made, the ideas that were exchanged, and we're going to continue to deepen this work with faith leaders in the coming weeks with the assistance of Dr. Daum. So we wanted to thank everyone for being part of that. I wanted to note that there was some discussion this weekend about decorations in long-term care homes, and that what you can expect on Wednesday after some consultation with all the health authorities is a provincial policy with respect to decorations. There is, in general, in acute care, and Dr. Henry can speak about this much more eloquently than I can, when outbreaks occur in acute care, whatever the outbreak might be, decluttering is a major part of it. But the difference in long-term care, of course, is that people are living in long-term care, that these are their homes, and this is an extraordinarily difficult time in long-term care. And so we will be coming forth with policies to both balance the obvious need for infection control, and we understand the need to do that, with the need, obviously, for joy and celebration at this time of the year for many residents living in long-term care. Just a few updates on hirings. One of the things earlier in the pandemic we regularly updated you on is emergency registrants under both as healthcare assistants and then as healthcare professions. That number of people on the nursing side and the healthcare assistant side is now 3,692, including hundreds and hundreds of people who've returned to the profession to provide care at this time, and we are very much appreciative of that. On Monday as well, bring you up to date on the acquisition of PPE. As you'll recall from last week's report, on Monday, December the 7th, just over 7,850,000 N95 or equivalent respirators have arrived in BC since March. Just over 133 million surgical or procedure masks, over 3 million pieces of eye protection, including goggles and face shields, about 306 million pairs of gloves, and 18.5 million gowns. Over the past week, the following PPE has arrived in BC: 95,795 or equivalent respirators, 4,397,200 surgical or procedure masks, and 3,664 pieces of eye protection. We continue to test our PPE to make sure that that it meets all standards, so that our healthcare workers can be sure that the PPE they are wearing and using meets the highest possible standard. Further, I wanted to update you on the flu immunization campaign, which is one of the vaccine campaigns we have going on right now. Of course, Dr. Henry has talked about what will be occurring tomorrow. But I just want to know, and this is an extraordinary achievement of our pharmacists, of our doctors of public health across BC, that as of December 10th, we know of at least 1,333,013 doses of influenza vaccine have been administered to British Columbians. We know that the actual number is higher. This is based on, there's a reporting lag of up to 30 days from pharmacists, physicians, and nurse practitioners in terms of immunization, but this is an extraordinary achievement at a time of pandemic. I would further note, just by way of comparison, that last year pharmacists delivered about half of our influenza vaccine in BC. That's 796,000 doses. That was all of last year. To date, this year, they've already delivered, and it's only the first part of December, 977,358 doses, and we are so appreciative of their work. Doctors as well have done hundreds of thousands more doses, more than previous years. And as you'll know, that all of our care homes and assisted living sites have received the Fluzone HD, the high-dose flu vaccine. So this is, again, an extraordinary achievement for public health, and we are continuing to do that. And as you can see, as we've reported in previous periods, that influenza is not making a significant appearance yet in British Columbia, and for that, we are very grateful. As we count down these days in this season, in December, it's hard to believe today is already December the 14th. It's equally and exciting that tomorrow we're going to see the first Pfizer vaccine used in British Columbia, the first immunizations occur, and that's a wonderful thing. But, this is a time, and I think Dr. Henry has talked about it in terms of how we celebrate in the home environment, especially when we're still counting on each other to do what needs to be done to stop the spread, to be 100% all in, to save lives, to give the most important gift of all to the most vulnerable who need it most: safety and good health for our seniors and elders. As we count down these days, for some to Christmas or some for other holidays, let's count up the times, places, and ways we can stop the spread, and then let's do it. Let's all contribute in making that the gift we give our seniors and elders: safety, good health, and the comfort that comes from both. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 11 et 12 décembre, celle des 12 et 13 décembre et celle du 13 jusqu'au 14 décembre en mi-journée. Il y a eu 49 nouveaux décès liés au COVID-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 647 personnes décédées du COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pour la première période de référence qui s'étend jusqu'au 12 décembre, nous avons eu 698 nouveaux cas. Pour la deuxième période de référence, nous avons eu 689 nouveaux cas. Au cours des dernières 24 heures, 759 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19,
359 personnes sont actuellement hospitalisées, dont 87 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And as a reminder to the media, please press star 1 to line up for questions. We will be taking one question and one follow-up this afternoon. Please do not mute your phones. You will not be heard until I call your name. We begin today with Shannon Patterson, CTV. Shannon, go ahead, please.
Oh, hi there. Dr. Henry, what percentage of the prioritized healthcare workers that are targeted for these first 4,000 vaccines have consented to receiving the vaccine, and would saying no impact their ability to work in a hospital or a long-term care home in the short or long term?
The answer to the second part is no. The answer to the first part is we actually don't know yet. What we are doing is people have been contacted and they've been given the time at the clinic for tomorrow. So we will know tomorrow a much better idea of who's shown up when and the number of people that have shown up for vaccines. So there's opportunities over the next few weeks for people. So we have not done prior consent with individuals.
Shannon, do you have a follow-up?
Yeah, Dr. Henry, were you able to see any of the footage of the first vaccines being administered in Canada? There was an 89-year-old woman in long-term care in Quebec and 5 healthcare workers in Ontario. It was really emotional, fellow workers applauding. Can you tell me what this momentous day means to you personally? And do you expect similar emotion when we vaccinate our residents tomorrow?
I think I felt this emotion when I heard the flight was on our way. But yeah, this is huge. And I did see, I didn't see the person in Quebec, but I did see some footage of the care worker in Ontario. And I know my colleagues and I, we were on a call this morning. You know, this is such an important thing. Who would have known just 11 months ago that we would have come together globally and, quite frankly, put the money towards developing a vaccine that is game-changing? It is what is going to make the difference. And I made the analogy last week that we're in the final leg of this now, but there is still a ways to go, and it's going to be hard. And especially it's going to be hard these next few weeks because we have potential and we are going to be saving lives with every single dose that we give. But it's not enough yet to stop transmission in our community. So we need to keep up and protect people. And my biggest fear right now is that we're not going to do enough. We're going to let off right now, and people are unnecessarily going to be exposed, and some of them will get very ill, will end up in our hospitals or end up dying at this point where we are so close. So I'm emotional every time I think about it, and I'm going to be at the clinic tomorrow, so I'm really looking forward to seeing the first vaccines go into arms of healthcare workers here in BC as well.
Thank you. The next question is from April Lawrence, Check News.
Oh, hi. Thank you. My first question is for Minister Dix. Minister, we're being told that as many as 80,000 BC healthcare workers on the front lines of the pandemic are still waiting for their COVID-19 top-up pay. It includes care aides in long-term care homes, hospital housekeeping staff right across the province. They say they're feeling left behind and forgotten, and I'm wondering if you can assure them that they will get the pay that they were promised and if they will get it before Christmas.
Thank you very much, April. I can assure them they will get the pay that they're promised. This process of pandemic pay has been quite complicated. I think the Ministry of Finance in BC has done a good job administering it, but nonetheless, it feels like it's taken too long because direct employees, for example, of health authorities have generally already received it, while others who are contracted providers providing healthcare services who are eligible for the pandemic pay in some cases have not, or in significant number of cases have not. I totally agree with their frustration, and obviously we feel it as well, but they're all going to get their pandemic pay as well and significantly and much more quickly. You'll recall that there was a significant increase when the single site order came into place, and those increases have been put in place long ago now, very significantly, because they were for direct employees at the time. There was no calculation of working with contractors after the fact. And so in all those cases, and that adds up when annualized, 165 million, which is how much less than what's called the HEABC wage those employees were receiving. Those increases are fully in place now and have been for some time. But I agree that it's taken too long. We all accept that. People are working through it very diligently. But everyone who's eligible for pandemic pay will receive it without question. And it would have been nice that it come sooner, but it's going to be coming.
April, do you have a follow-up?
I do. Thank you. For Dr. Henry, we're nearly a month into the social restrictions that you put in place province-wide on November 19th. I'm wondering if, when looking at today's numbers, if you feel like they're having the desired effect, and if they aren't, if we can expect any further restrictions.
Yeah, so we did refine things. We looked at things in some detail, and we do monitor where we're seeing transmission events happening. So I don't expect to have to change things in the short term. You know, we are looking out through this next few week period. We have flattened. We are not back down, and part of that reflects the fact that we had flattened at a fairly high level, and there's still ongoing transmission in those close environments. So it's the people we work with, the people that we're in our homes with. But we have seen a very steep decline in the large gatherings and transmission to people in those settings, but they still happen. And unfortunately, we are still seeing smaller numbers, but even that small dinner party where you pass it on to 4 or 5 other people, and then they may go to work, pass it on to inadvertently to people at work. So those chains of transmission are still happening. I think what we've put in place, we've seen an effect from that, particularly in some areas of the province. But we have challenges, and we have challenges in the interior where we are now seeing celebrations, parties, things happening where people are coming together, where large groups of people are living in shared accommodations and transmission happens. So we're not out of the woods yet, but the measures that we have put in place are making a difference. We need to continue to pay attention to those and recognize, as I've mentioned many times, right now, because of the level of transmission in our community, and part of that is the way the virus transmits so much more easily this time of year, that even small gatherings are risky. And we all need to recognize that. And that's one of the reasons why all the events that we've had, the event restrictions and the coming together, whether it's for hockey teams or other types of occasions, that is really important more than ever as we go into these holiday weeks.
The next question is from Justine Hunter, Globe and Mail.
Thanks for this. Shannon mentioned in her first question the residents of Quebec nursing homes that are getting the vaccine this week. When do you expect residents in care homes will be receiving that here in BC?
Yeah, so we are absolutely, that's a priority population. We are starting with healthcare workers who work in those care homes. There's restrictions on movement of the Pfizer vaccine for the first couple of weeks. So once we have the supply and the handling down so that Pfizer's comfortable with it and we're able to move Pfizer vaccine into communities. So it's a very delicate vaccine, and it's very unstable once it's been thawed and has to be used within a very short period of time. So those logistical constraints make it challenging. We are looking at, as soon as we can, we will use Pfizer vaccine. But the other thing that we're looking at is the Moderna vaccine has less stringent restrictions because of the way it's manufactured, and it can be moved around more easily at fridge temperatures. So as soon as one or the other is available, we'll be looking at how we can move it out to long-term care homes rapidly.
Follow-up, Justine?
Yes, thanks. I know Quebec might be the outlier. Do you understand why they are able to deliver this vaccine to care homes today and not parts of the country?
Not everybody else, because they have two very large hospital/care homes where they have used as their point of arrival and pre-positioned ultra-low temperature freezers, which was the requirement for this first week. We don't have that type of facility in BC where there's enough numbers, so you can't break down and transport part of the tray. The frozen trays come in 975 dose trays, so we are bringing people to where we can provide the vaccine. The types of facilities that they have as their point of arrivals, they were able to use up those doses in that facility. So it's just a different way that our healthcare system has different types of facilities.
The next question is from Richard Zussman, Global News.
Dr. Henry, on the vaccine, BC, unlike other provinces, has decided to provide the first 4,000 or some odd dosages right away rather than save them, split them in half and save half for the second dose. Can you explain why BC has done this? Do you believe it's risky in case the next set doesn't come in time? And what is the proper amount of time to wait between first and second dose?
Yeah, so all provinces, to the best of my knowledge, at least the discussions we have had in the past many days, including yesterday and this morning, are using all of their doses this week for first doses. So we're going to use all 3,900 of our doses to give the first dose of people to as many people as possible. The recommendations for both the Pfizer vaccine and the Moderna vaccine is that it's a 2-dose program. With the second dose, what we have is a minimum interval between doses. So you can't give them too close together, or the immune system doesn't recognize them as two different doses, and you don't get that boosting response. So the minimum interval is 19 days. The recommended interval is between 21 and 28 days for the second dose. We are looking at when we can operationally give the second dose, and it, of course, depends a lot on when vaccine comes in, but we have guaranteed delivery for next week, the week of the 21st and the week of the 28th of December, and our intent is to give them all as first doses and then give second doses once we start receiving vaccine in January. So there's a whole bunch of different factors that go into that. Right now, we are at the peak risk in our community, and making sure that we protect as many people as possible with that first dose is our first priority, recognizing that we are receiving more vaccine in higher quantities in the weeks to come. So those are all considerations that are operational considerations that we're having across the country. But I have a real challenge leaving vaccine in a fridge when there are so many people at risk right now.
Follow-up, Richard?
Dr. Henry, Global News has interviewed a woman and her son. He's 12 years old. He has autism and other psycho disorders that lead him to great anxiety when putting on a mask. His pediatrician has provided them a note, and they went to a Chapters bookstore and were denied entry because he couldn't wear the mask. We've interviewed another woman who's gone to Chapters who doesn't have hands, and she physically can't put on a mask, and again, she was denied entry at the Chapters. Is the mandatory mask policy properly being administered in these situations?
Yeah, well, you know, that there's lots of situations, and what I've said, that we need to make accommodation for people who can't wear masks, and whether that accommodation means taking their order outside and providing them with what they want, ordering online, finding ways that people can get what they need when there's not other people around. There are things that can be done to facilitate people and to accommodate people who can't wear masks. So obviously I can't talk to those specific situations or what actually happened there, but these are the things that I expect will happen to support people who aren't able to wear a mask in their community.
Thank you. The next question comes from Marcelo Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. First off, just regarding the outbreak at the Regent School in Surrey, I believe, it's closed after recording at least 30 cases. And just wanting to get more clarity from you about, did that particular school fail to follow protocols, or is this another example of general community safety plans failing?
Yeah, there are ongoing investigations at that school, and there were a number of different cohorts and different transmission events, particularly amongst adults at the school. So challenges, and once it was recognized that there was transmission happening in different areas, and particularly the numbers of people involved, particularly the adults in the school, it was felt best to close the school.
Follow-up, Marcella?
Yes, it's just heartbreaking to me to hear that another 48 people have died. And I'm wondering if you can elaborate more on the communications breakdowns that we're experiencing when it comes to health authorities like Vancouver Coastal not disclosing specific details about how many cases are actually linked to outbreaks in long-term care, like we saw at Little Mountain over the weekend. And that's something that Fraser Health easily shares. Are you concerned about information not being shared publicly so that people can decide for themselves whether or not they need to know this information?
I'm not sure exactly what information you're talking about. We do provide information about the outbreaks at care homes in particular, and have all along. It is tragic, and I can say without a doubt that it's consuming a lot of our time, our efforts, trying to ensure that what measures we have in place are working, both in Fraser Health, Vancouver Coastal, and other health authorities. It is such a challenging thing because healthcare workers reflect, again, what is happening in our communities, and we know that when transmission goes up in the community, we're all at risk, and that puts our long-term care homes at risk too. And what we see today in the numbers, as you say, it breaks my heart every time a single person passes away from this virus. And we are doing everything we can to keep it out of care homes, and once it gets into long-term care homes, it just passes so quickly, and that is our big challenge right now, especially right now. And this is why our focus is on protecting people as soon as we possibly can with vaccine.
Thank you. The next question comes from Caden Fanshaw, CKPG.
Hi there. Maybe this is better off for Minister Dix, but we've heard there are a number of surgeries being canceled or postponed in northern BC because of capacity issues. Just wondering if you could, what information do you have on that, and is the surgical renewal program slowing because of climbing COVID numbers in hospitals?
Well, the surgical renewal program has been an extraordinary success, and it's not, as I say, my success or the government's success, the health system's success. It's a success for healthcare workers and those working in the area. So we've been consistently doing, in the midst of a pandemic, more surgeries that were done last year, for example, and last year was a record year for surgeries. So it's been an extraordinary success. What happens in certain circumstances where there's a lot of cases of COVID-19 or other circumstances, I'll give you an example that we raised last week, which was both the fire and then the outbreaks at Burnaby General Hospital. This led to the cancellations of some surgeries. Equally, right now at Prince George Regional Hospital, I think there are roughly 46, 47 people, just from memory, in hospital in the Northern Health Authority, but the large majority of those, around 40, are at Prince George Regional Hospital, not Prince George, the University Hospital of Northern British Columbia. And so at that hospital, they make adjustments all the time for those circumstances, and that's what they're doing right now. I don't think it puts at risk our surgical renewal plan in a general sense, but we expect people to make decisions based on the circumstances in front of them. As you know, there are a significant number of people there right now, I think 10 to 12 as well, in critical care at the University Hospital of Northern BC. And the result of that is that they're going to make adjustments from time to time there. In the other parts of Northern Health, there are dramatically fewer critical care beds, and there's less interruption right now, either at Mills, Memorial and Terrace, or in Fort St. John, or at other other hospitals. And in Prince George right now, they're taking on for the north the bulk of cases, and you will see some change and some adjustment to address that situation, as you would see in any hospital in those circumstances. But I expect, and we're continuing to see excellent results on surgical renewal, and that means that people who need care are getting care, and that involves extraordinary generosity and courage of surgeons and nurses and health sciences professionals and healthcare workers who are working in the area, and that'll continue. But adjustments are going to be made from time to time, as they were in Burnaby, as they have been at Lions Gate, where there has been an outbreak that was significant in recent weeks, as would happen at University Hospital in Northern British Columbia. But I expect to be back on track and to stay on track in Northern Health, just everywhere else in the weeks and months to come.
Do you have a follow-up, Caden?
Yes, I do. I just wanted to say thanks for answering that question. And maybe this is one for Dr. Bonnie Henry. Just wondering more details on the distribution plan for a vaccine away from the Lower Mainland as it goes across different health authorities.
Sure. So our agreement with Pfizer limited the country to 14 point of arrival sites, they call them, POAs, and we were given 2 POAs, and they had to have the ultra-low temperature freezers just in case, so that we could verify each step of the process. So given the epidemiology that we're seeing as well, both of those sites are in the Lower Mainland, one in Fraser Health and one in Vancouver Coastal, for this week. So that is to our proof of concept, making sure that we've got everything down, that we know how to run the clinics, and we are going through them in some detail. Dr. Ross Brown and I are leading immunization operations center, so that we have a standard protocol, and we're working with all of the health authorities. So we've identified 9 sites around the province, and starting next week, vaccine will be delivered to all of the sites in each health authority. So there will be vaccine delivered to the north, to the interior, and to Island Health next week.
Thank you. The next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. Do you have any specific information about how many people in unhoused communities have contracted COVID-19, and have there been any outbreaks linked to encampments or shelter sites so far?
I'm sorry, linked to shelters or which?
Encampments or shelter sites.
Yeah, we've had very few in encampments. There has been cases in a number of shelters and SROs, particularly in the downtown east side. And we had an outbreak, as we reported, in the Cove shelter in the Fraser Health region. We do have ongoing transmission at a low level, particularly in some of the transient homeless shelter-using populations in the urban areas in Vancouver, mostly linked to the downtown east side. We know as well in Nanaimo there's been challenges around one of the encampments where there was a fire and people have been displaced and concerned there. But for the most part, we have teams that are working in each of the health authorities in those high-risk areas, in Prince George as well, and in the interior, to try and address them, and to try and we've got proactive surveillance going on. I don't have the numbers in front of me, but they are reported in the LHA reports that were up on the BC CDC website last week. But it has been an ongoing challenge, and certainly a very vulnerable population. We know, for example, in the downtown east side, the proportion of people who test positive for COVID-19 and need hospitalization is much higher than what we see in populations outside of that area. So we know it is people who are more at risk of having severe illness, and that is something that we're factoring into our response.
Do you have a follow-up, Brishti?
No, thank you. Thanks for answering my question.
Thank you. And we have time for one more question this afternoon. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Ethan Sawyer, CBC.
Dr. Henry, we are hearing about people doing pre-Christmas quarantines, basically so that they can see family members who have also quarantined ahead of the holidays. Some parents are even pulling their kids out of school early to accomplish this. Just wondering what you say to the people who are taking this approach. Are you for it or against it?
Is it only black or white? I have to say that, that is people's choice, of course, and people want to do the best thing to try and keep each other safe. But we have seen in other places where people have tried to do this that it is not foolproof, and there are challenges. Not everybody understands the same meaning of quarantine and takes the same precautions, and you may be at risk. Others, particularly if you have elderly people that you want to be around, take extra precaution. If you do feel like you're doing this and you want to be with elderly parents or grandparents, particularly if somebody's alone and you want to be with them at this holiday season, then make sure you keep your distances. Wear masks when you're close together. Take some extra precautions to keep them safe, particularly right now. We want to do everything we can to protect people who are most at risk, because we have protection coming. It's not here and enough to give everybody all at once, but it's coming, and we don't want to be the one to pass it on to our loved one when the end game is so close.
Do you have a follow-up, Ethan?
I do. It's for Dr. Henry again. So given all that, how concerned are you about a spike in cases after Christmas, similar to the one we saw in Thanksgiving? I know you mentioned to Shannon that you are feeling fearful. And can we get an answer in French as well?
Sure. I think it's our human nature to want to be together. We are creatures who need contact with each other. And I know for some people that pull, that desire to be physically together is very important. But I want to reiterate, now is dangerous. There is no safe gatherings. This virus doesn't recognize that you've been apart for so long that you really need to see somebody. This virus passes between people. So we pick up the risk from where we've been and we take it to where we go. And if we're around people who are vulnerable, who are more likely to end up in hospital to get sick, then we're putting them at risk. So we need to step back, stay with our households, stay small, make sure we're not the ones that are inadvertently bringing this into our community or to people that we care the most about. That is the important thing right now. And if we all take these measures and pay attention to that, we can avoid that post-holiday peak that we've seen in many other places, that we're seeing in the United States. We are this close right now. We have vaccine here in the province. We're going to be able to protect people. Now's our time to just, I don't know what the word is, to double down, to remember that this is the hardest period that we're going to be going through. But we can get through this, and we can support each other. We can be adaptive. We're resilient. We've seen that for the last 11 months. And now's not the time to let that go. We can save lives, and we can do that by staying small, staying together, being with our family, going outside, finding that beauty and joy every day. And that's what will get us through the next few months.
Oui, comme vient de dire Dr. Henry, je pense que ceci est le moment, décembre 2020, le moment le plus dangereux. On ne peut pas négocier avec le COVID-19, on ne peut pas négocier avec le virus. Il faut absolument, pendant cette période, ce mois,
suivre les conseils et les règles de la santé publique. Il est absolument essentiel en ce moment de le faire. Et on sait bien que c'est difficile, que cette période de Noël, surtout cette période de décembre, c'est une période où on veut se rassembler et d'être ensemble avec ceux qu'on aime. Mais cette année, la manière d'aimer doit être différente. Et il faut absolument se protéger. On peut sauver des vies pendant ce mois de décembre si on suit les conseils du Dr. Henry. Et il est absolument essentiel que tout le monde dans cette province, ne pense pas comment je peux jouer avec les règlements, mais d'écarter toute idée de jouer avec les règlements et protéger les personnes qu'on aime et les personnes qu'on ne connaît pas. Merci beaucoup. Thank you very much. We'll see you soon.
Thank you very much. This is all the time we have this afternoon. Thank you all for joining us.